My grandmother died because she thought it was just a headache. She was 73, strong-willed, sharp as ever, still gardening every weekend and cooking for the whole family every Sunday. That morning, she told my uncle she felt dizzy and had a weird pain behind her eye. She laughed it off and said she just needed to rest. By evening, she couldn't speak. By midnight, she was gone. No one recognized the signs, not even her. And by the time help arrived, it was too late. What hurts the most is knowing it didn't have to end that way. You see, stroke doesn't always look like what we think it does. It can be silent, fast, and devastating. It can rob you of your words, your movement, your memories in just minutes. But what if you could prevent that from happening to you or to someone you love? That's exactly why we made this video, because the truth is up to 80% of strokes and heart attacks can be prevented. And yet most people don't know how. Today, we'll walk you through what really causes strokes, how to spot them early, and the top 10 doctor-approved ways to stay safe. But first, let me take you inside what really happens in the brain. When time runs out. Imagine your brain as the control center of your entire body. It's constantly sending signals telling your heart to beat your lungs, to breathe your legs, to move your mouth to speak. But here's something most people forget. Your brain needs a steady stream of oxygen-rich blood to keep working, and even a short interruption can be catastrophic. That's what a stroke is. It's not just a problem in your head. It's a sudden loss of blood flow to part of your brain. And without blood, brain cells start dying fast. Not days, not hours, we're talking minutes. Think of it like this: if your kitchen faucet suddenly stopped flowing, your dishes wouldn't get clean. Now imagine that same blockage happening in a blood vessel inside your brain. The part of your brain that's supposed to control your right hand. Gone. Your ability to speak gone. Your memory of your own children may be gone too in a matter of moments. Now here's where it gets worse. Sometimes the blood vessel doesn't just get blocked, it bursts. That's what we call a hemorrhagic stroke. The brain starts bleeding from the inside, creating dangerous pressure that can crush healthy tissue. Either way, blockage or bleed every second matters. And the scariest part, many people have no idea it's happening until it's too late. But here's the hope. When you understand how strokes work, you can recognize the warning signs early. And you can act. That's why we say, time is brain. In the next section, we'll break down the two main types of stroke and what makes them so different, so dangerous, and so preventable. Not all strokes are the same, but every type is serious. There are two main types of stroke, and knowing the difference could save your life. The first is called an ischemic stroke. This is the most common, making up about 87% of all cases. It happens when a blood vessel in your brain gets blocked, usually by a clot. Think of it like a clogged drain. When the pipe gets blocked, water can't flow through. In your brain, that water is blood-carrying oxygen. No flow means brain cells start to suffocate and die. Sometimes the clot forms right there in the brain's blood vessel, often because of atherosclerosis, which is a buildup of fatty deposits. Other times, the clot forms in the heart, especially in people with atrial fibrillation, and then travels up to the brain. Either way, it's like a ticking time bomb. Then there's the second kind, the hemorrhagic stroke. This one is less common, but far more deadly. Instead of a blockage, the problem is a burst. A blood vessel ruptures and starts bleeding inside your brain. That blood doesn't just leak. It builds up pressure-crushing healthy brain tissue. It's like a balloon popping inside a closed box. Hemorrhagic strokes are often caused by uncontrolled high blood pressure or by weakened blood vessels from conditions like aneurysms or arteriovenous malformations. And in some cases, blood thinners, when misused, can make the bleeding worse. Both types are medical emergencies. But here's the thing, their treatments are completely different. That's why it's so important to get the right diagnosis fast. In the next part, we'll go even deeper. What exactly happens inside your brain during a stroke? And how fast does the damage begin? Let's take a closer look at what's really going on inside your brain when a stroke hits. Picture this. You're sitting in your chair, maybe sipping coffee or reading the paper. And within seconds, something changes. You can't lift your arm. Your words won't come out right. It feels like your brain has disconnected from your body. That's not an exaggeration. That's exactly what happens because your brain is starving. When a stroke occurs, blood flow to part of the brain suddenly stops. That means no oxygen, no glucose, and brain cells begin to die within minutes. It's like flipping a switch, shutting down power to everything controlled by that area speech movement memory, even swallowing. Doctors divide the damage into two zones. The core is ground zero, the area with no blood flow at all. Those brain cells die quickly and can't be saved. But surrounding that is the penumbra, a zone where cells are injured but still hanging on. These cells are in a fragile state. They're like lights flickering in a storm. If you act fast, they can be rescued. This is why stroke treatment is a race against time. Every minute, nearly 2 million brain cells can be lost. That's why doctors say time is brain. It's not just about survival. It's about saving your ability to speak, walk, remember names, or hold your grandchild again. And here's the hardest truth. Most of that damage could be avoided if we catch the stroke early. So the next step, learn to spot the signs. Coming up next, we'll walk you through the early symptoms of stroke and how to respond before it's too late. A stroke doesn't always come with a loud warning. Sometimes it's quiet, almost easy to miss. And that's exactly what makes it so dangerous. You might feel a sudden weakness in your arm, or your words come out jumbled like your mouth can't keep up with your thoughts. Maybe your vision gets blurry in one eye, or your balance feels off like the floor is shifting beneath you. Most people ignore these symptoms thinking it's just stress or that they slept funny. But that delay can be deadly. That's why doctors use a simple tool to help people remember the key signs of stroke. Be fast. B. Balance. Is there a sudden loss of balance or coordination? Eyes, any trouble seeing clearly in one or both eyes. F. Face. Does one side of the face look droopy or feel numb? Ask the person to smile. Is it uneven? A. Arms. Is one arm weak or drifting down when raised? S. Speech. Is their speech slurred, strange, or hard to understand? T. Time to call 911. If any of these signs appear even for a moment, call emergency services immediately. Here's what's critical. Don't wait to see if it gets better. Every second counts. Even if the symptoms disappear in a few minutes, it could be a warning, a mini stroke or TIA, and the next one might be full-blown. You don't need to be a doctor to save a life. You just need to remember, be fast and act fast. Up next, we'll talk about what happens at the hospital and how doctors decide what treatment you need based on the type of stroke you're having. When someone shows signs of a stroke, the clock starts ticking the moment they walk through the hospital doors, and every second can change their future. First, doctors work fast. They ask questions. When did the symptoms start? What were they doing when it happened? Then comes the most urgent step, a brain scan, usually a CT scan or MRI. This tells them something vital. Is the stroke caused by a blockage or bleeding? Why does that matter so much? Because the treatments are completely different. If it's an ischemic stroke caused by a clot, the goal is to break it up and restore blood flow. One powerful tool is a medication called TPA. It's often described as a clot buster, and it can save brain cells, but only if it's given within a narrow window, usually within 3 to 4.5 hours after symptoms begin. For more severe blockages, doctors may perform a mechanical thrombectomy. That's when a tiny device is threaded through the blood vessels to physically remove the clot, like pulling debris out of a blocked pipe. This can sometimes be done up to 24 hours after the stroke starts, depending on the situation. If it's a hemorrhagic stroke bleeding in the brain, then the focus shifts to stopping the bleeding and relieving pressure. This may involve medication reversing blood thinners or even surgery to repair the vessel or remove blood buildup. It's intense, it's fast, and it's why getting to the hospital right away can be the difference between walking and never walking again. But the best treatment of all, prevention. And coming up next, we'll share the top 10 ways to reduce your risk starting today. Here's the part no one talks about enough. Up to 80% of strokes and heart attacks can be prevented. That's not a hopeful guess, that's a fact backed by science. And the good news, most of what you need to do isn't complicated. It's not about being perfect. It's about being consistent and starting with these 10 doctor-approved habits. Control your blood pressure. This is number 1 for a reason. High blood pressure silently damages blood vessels, and is the leading cause of both strokes and heart attacks. Get it checked regularly and treat it seriously. Lower your cholesterol. Too much LDL, the bad cholesterol, leads to plaque buildup in arteries. Over time, that can cause blockages or clots. Manage your blood sugar. If you have diabetes or prediabetes, keeping your numbers under control protects both your heart and your brain. Eat smart. Fill your plate with vegetables, fruits, lean proteins, whole grains, and healthy fats. Cut down on salt and processed foods, especially anything that comes in a box or a bag. Move more. You don't need a gym. A 30-minute walk a day can do wonders. Even gardening or dancing counts. Quit smoking for good. Tobacco thickens your blood and narrows your vessels. Quitting today changes your future. Drink less alcohol. Heavy drinking raises your blood pressure and risk of bleeding in the brain. Treat atrial fibrillation AFib. If you've been told you have an irregular heartbeat, don't ignore it. AFib raises stroke risk 5 times. Stay at a healthy weight. Even losing 10 pounds can lower your stroke and heart attack risk. Get regular checkups. Many stroke risks are silent. A yearly visit could catch something before it becomes dangerous. Small steps, real results. Your life, your choice. Next, let's talk about why routine screening and early detection are especially critical after age 60. If you're over 60, here's something you should know. Your risk of stroke and heart attack doesn't just increase with age, it becomes less obvious. Many of the most dangerous conditions that lead to stroke, like high blood pressure, high cholesterol, or atrial fibrillation, are silent. You don't feel them. You don't see them. But they could be quietly damaging your blood vessels every single day. That's why regular health screenings are not just a recommendation, they're a lifeline. Take atrial fibrillation, for example, an irregular heartbeat that affects millions of seniors. Some people feel it as a flutter, others don't notice it at all. But untreated, it can lead to blood clots that travel to the brain and cause a massive stroke. In fact, AFib increases your risk of stroke by 5 times. The same goes for carotid artery blockages, buildups of plaque in the neck arteries that supply blood to the brain. You won't feel them coming, but if they rupture, they can cause an ischemic stroke in seconds. With a few simple tests like a blood pressure check, cholesterol panel, heart rhythm monitor, or carotid ultrasound, your doctor can detect these hidden dangers early. And when caught early, they're often manageable or even reversible. Think of screenings not as bad news waiting to happen, but as a form of protection. They give you the power to act before something worse happens, because what you don't know can hurt you, and what you do know can save your life. Next, let's talk about what every doctor wishes their patients understood earlier, before it was too late. Ask any doctor who's worked in the ER, they'll tell you the same heartbreaking truth: most strokes didn't have to happen. And more often than not, the person who had the stroke ignored a small sign, or thought they had more time, or simply didn't know what to watch for. One doctor told me about a 72-year-old man who came in slurring his speech. He'd been feeling a little off all day, but he didn't want to bother anyone. By the time he arrived, his stroke had already done permanent damage. He survived, but he never spoke clearly again. That doctor looked down at his chart and whispered, if he'd just come in 2 hours earlier. So what do doctors wish every patient over 60 understood? They wish you knew that a stroke doesn't always feel dramatic. It can feel like your arm just fell asleep, or like you're unusually tired, or like you forgot a word and brushed it off. They wish you knew that high blood pressure, high cholesterol, and AFib are not just numbers. They're warnings, and they wish you didn't wait for pain before getting checked, because by the time it hurts, it may already be too late. Most of all, they wish they could go back in time with every patient and say, please don't wait. But they can't. You can. Next, I want to take you back to where we started, to a story about my grandmother, and the moment that still haunts me today. I still remember the sound of the nurse's voice when she came out of the hospital room. Quiet, careful, like she didn't want to say what we already knew. My grandmother was gone. She had been laughing just the day before. She was sharp, loving, stubborn, the kind of woman who made everyone feel like home. And yet within hours of that strange headache, she couldn't speak. She couldn't move. She never woke up. The doctor said it was a massive hemorrhagic stroke. A blood vessel in her brain had ruptured, likely from years of untreated high blood pressure. She never even knew she had it. And the worst part, she wasn't alone. Every day in America, families sit in waiting rooms just like we did, wondering how something that seemed so small, dizziness, slurred words, a dropped fork, turned into something so permanent. That's why I made this video. Because if even one person watches this and catches the signs early, if one family member says, "Let's get you checked," if one stroke is prevented, then maybe someone else's grandmother gets to stay at the table one more year, one more holiday, one more hug. So please don't wait. Learn the signs, take care of your health, talk to your doctor. And if this video moved you in any way, I ask just one thing: share it. You might save a life without even knowing it. Because stroke doesn't wait, and neither should you. If you've made it this far, you've done something powerful. You've taken the time to understand what stroke and heart attack really mean, and more importantly, how to prevent them. But knowledge alone isn't enough. Now it's time to act. Start by checking in with yourself. When was the last time you had your blood pressure checked? Do you know your cholesterol levels? Have you ever been screened for atrial fibrillation? Then look around you. Is there someone in your life, a spouse, a sibling, a friend who shrugs off their symptoms, avoids doctor visits, or says, "I'm fine, I don't need help"? Forward this video to them. Sometimes hearing it from a voice they trust can make all the difference. And if you've ever experienced something strange, numbness, confusion, blurry vision, a moment of slurred speech, tell your doctor. Even if it passed quickly, especially if it did, because the next time might not pass. Lastly, we'd love to hear from you. If you or someone you love has lived through a stroke or a heart attack, or if this video made you see things differently, please share your story in the comments. Your words might be the reason someone else pays attention. Remember, stroke and heart attack are not just medical events. They're life-altering moments that often come without warning. But with awareness, with action, and with each other, we can change that. Take the next step. Start the conversation. And most of all, stay healthy. Let's end this with something you may not hear often enough. It's never too late to take control of your health. You are not powerless. Whether you're 61 or 91, every choice you make today to move your body. Eat better. Check your numbers. Speak up when something feels off. Those choices matter. They add up. They protect your independence, your memories, your time with the people you love most. Yes, stroke and heart attack are serious. Yes, they can be frightening. But fear isn't the message we want to leave you with. Hope is. Because you now know the truth. You know the signs. You know what steps to take. You've heard the stories, the science, the simple actions that truly make a difference. And by watching this video, you've already done more than most people ever do. That makes you part of the solution, and for that, we thank you. If you found value in this message, we ask just one thing: share it. With a friend, with a loved one, maybe with your community group or church. You never know whose life you might touch just by passing it along. And if you want more health guidance, real stories, and expert advice tailored to your stage of life, don't forget to subscribe. This is just the beginning, and we're here with you every step of the way. Stay strong, stay curious, and above all, stay connected to your health, to your loved ones, and to the life that still has so much ahead. Thank you for watching.